everyone, it's Sarah with RegisteredNurseRN.com, and in this video we're going to go over canes, crutches, and walkers. And as always, whenever you get done watching this video over assistive devices, you can access the free quiz. For exams in nursing school, you want to make sure that you are familiar with assistive devices such as crutches, canes, and walkers. And in our next videos, we will be talking about canes and walkers. So with crutches, what you specifically want to know for exams is how they should properly fit, the different types of gaits you can do with crutches, how a patient should go up and down the stairs with crutches, and how they should get up or sit down in a chair. So first, let's talk about proper fit. What are some things that you need to see in your patient that tells you that those crutches fit them properly? Well, before a patient even starts using crutches, the crutches will have to be adjusted based on the patient's height. And they can be adjusted at the bottom and at the top. And usually on most crutches, there's a height range where you will slide the part of the crutch to meet whatever your patient's height is. Also, there's a hand grip on the crutch that can be adjusted as well. So some things you want to remember is that you want to be looking at the gap between the crutch rest pad and the axilla, the armpit. There should be a gap there. It should be about 2 to 3 fingers width, which ends up being about 1 to 1.5 inches. And the reason you want this gap is because while the patient is using the crutch, they need to be putting all their weight on the hand grips rather than on this crutch rest pad via the axilla area. Because in this area you have nerves, and if they're putting all their weight on that, number one, it's really going to be uncomfortable and hurt, but it's also going to damage those nerves in that area. Also, you want to be looking at the hand grips and where they're lining up on the body. The hand grip should be even with the top of the hip line. So whenever the patient actually uses the hand grips, their elbow will be slightly bent at about 30 degrees. Now let's talk about the different types of gaits while using crutches. And you want to make sure that you really truly understand these different types of gaits that I'm going to go over, because exams love to give you a description of a gait that a patient may be doing while using crutches, and you'll have to identify it. So before a patient even starts ambulating with crutches at first, you want to make sure that they are wearing a gait belt for safety. Also, before they start doing one of these type of gaits, they're going to start in the tripod position. And it looks something like this, and it forms like a triangle, hence looks like a tripod. And this is where the crutches are about 6 inches out diagonally from the feet. So first, let's start out with the point gaits. We have 3 of them. We have the 2-point gait, the 3-point gait, and the 4-point gait. Now, how you can keep these straight is that you need to ask yourself, how many points are on the ground? Hence, how many crutches are on the ground and how many feet are on the ground whenever you're looking at the scenario. Because each crutch counts as a point and each foot counts as a point. So the 2-point, we're going to have 2 points on the ground at a time, whether it's a crutch or a foot. So what does it look like? Well, this is where the patient will move the crutch on the injured side. So we're going to say it's the right side. So they move the right crutch and they move the left foot together. Then they will move the left crutch on that non-injured side and the right foot together. So you have 2 points. Next is the 4-point gait, and it's a little bit similar to the 2-point gait, but each point is moving separately, because remember in 2-point they were moving together, the right and the left moving together, and then the left and the right moving together. But here with 4-point, they're separate. So the patient will move the right crutch, which is, we'll say, the injured side. Then they'll move the left foot, then they'll move the left crutch, and then they'll move the right foot. And the last point gait is the 3-point gait. And this is where they move both crutches and the injured leg together at the same time, and then they will move the non-injured leg. And then lastly, we have the two swing gaits, and it's either a swing to gait or a swing through gait. And let the names help you. So the swing to gait is where the patient will move both crutches forward. Then they will hence swing or move both legs forward and place them at the placement of where the crutches are located. Now, the swing through is very similar to this. They will move both crutches forward, then they will move both legs forward, hence swing both legs forward, but they will swing it past the crutch placement. Now let's talk about stairs. How does a patient navigate up and down the stairs while using crutches? Well, you want to keep these two straight, and what I'm meaning is which leg is going to go first up the step versus which leg is going to go down the step first. And to remember that, remember good up and bad down. So whenever a patient is going up the stairs, their good leg is going to go first up on the step, followed by the crutches and the bad leg, which will proceed and go up the step. Now, whenever they're going down the steps, they're going to move the crutches down onto the step. That'll help provide stability, followed by the bad leg, because the bad leg is going to go down, and then they're going to move the good leg down onto the step. And lastly, we're going to wrap up the lecture and talk about how a patient sits down and gets up while using crutches. To sit in the chair, the patient's going to back up to the chair and fill the chair with the non-injured leg. And when the patient fills the chair with the non-injured leg, they're going to stop and move both crutches over to the injured side for support. Then the patient's going to grip the hand grips and slightly bend the non-injured leg and fill behind them, and then sit in the chair while keeping the injured leg extended. To get up from the chair, the patient is going to take the crutches and put them on the injured side for support. He's going to keep the injured leg extended and push up on the non-injured side and using the hand grips of the crutches. Then he's going to put the crutches in position. For canes, you want to make sure that you're familiar with how a cane should properly fit a patient, how to actually walk with a cane, how a patient should go up and down stairs with a cane, and how they should get up from a chair or sit down in a chair with a cane. Therefore, let's start with the proper fit. How do you know as the nurse that this cane actually fits your patient? Well, before a patient uses a cane for the first time, it has to be adjusted. Most canes can be adjusted at the bottom by sliding the cane into location of where it should go to fit the patient. But once the patient is holding the cane, or once they have the cane standing beside their body, how do you know it actually fits the patient? Well, there's two ways you can tell. The first way is that the top of the cane, which is about this area here, should be even with the great trochanter. The great trochanter is a prominence of the femur. So that top of the cane should rest about right there whenever the patient's standing up and has the cane beside of them. Or the top of the cane should be even with the wrist crease that is closest to the hand. So those are two ways you can tell. Also, whenever the patient is holding the cane, the elbow should be flexed at a 15 to 30 degree angle. So those are some things that you can look for as the nurse to tell you that this cane properly fits your patient. Now let's talk about how a patient should walk with the cane. Before a patient starts using their cane and practicing with it, you want to make sure that they are wearing a gait belt for safety. In addition, you're going to stand on the patient's weak side in case they lose their balance. So whenever they start using the cane, they want to make sure that they're in the proper position. The position that they want to be in, they want to make sure that they are positioning the tip of the cane at least 4 inches from the side of the foot. And they want to hold the cane on the strong side of the body. So remember that. The cane needs to be on the strong side. Very important concept to remember. So how are they going to actually ambulate with this cane? Well, to ambulate with the cane, what they're going to do is they're going to move the cane with the weak side together forward. So they move the cane along with their weak side together. Then they will move the strong side forward. So how does a patient go up and down the stairs with a cane? Well, the concept is the same like how we learned with crutches. Remember, I told you to remember up equals good, down equals bad. And what we're referring to is the good leg going up first, which would be the strong leg, versus whenever we're going down the stairs, it would be the bad leg that's going to go first, so the weak side. Therefore, how do we go up the stairs using that concept? Well, what the patient wants to do is they want to hold the cane on that good/strong side. Then they're going to move the good leg up onto the step, and they're going to put weight onto the cane and then move the cane and the bad leg up onto the step. Now to go down the stairs, the patient again is going to hold the cane on the good side, that strong side. They're going to move the cane down onto the step with the bad leg. So the bad leg is going down. Then they're going to move the good leg down onto the step. And lastly, let's talk about how a patient will sit down and get up using a cane. To sit down with a cane, the patient is going to back up to the chair until he fills the chair with the back of the legs. Then the patient will allow the cane to rest on the side of the chair and place both hands on the chair's armrest and place weight on the hands while keeping the weak leg extended out and bend the strong leg to sit down. To sit up with the cane, a patient is going to place the cane on the strong side and lean forward in the chair while keeping the weak leg slightly extended forward. Then the patient is going to push down on the cane's hand grip and the chair armrest, and then put weight on the strong leg and stand in position with the cane. When you're studying walkers for your exams, there's some things you want to remember. You want to remember the proper fit, what are those characteristics that the walker actually fits your patient, how to walk with the walker, so the gait, and how the patient should get up and sit down in a chair. So first, let's talk about proper fit. How do you know that this walker actually fits your patient? Well, before a patient even uses a walker for the first time, it has to be adjusted. And on most walkers, they're adjusted down at the bottom. You have to adjust each leg. There's 4 of those legs. So you've adjusted the walker. Now what do you look for? These are things you want to remember for your exams. Well, have the patient hold onto the hand grips while they're standing with the walker, and you're going to look at that elbow. There should be about a 15 to 30 degree bend in the elbows. Also, when the patient holds their arms down at their side, their wrist crease should line up with those hand grips. Those 2 things really tell you that this walker fits this patient. The next thing you want to know about is the gait. How does your patient actually walk with the walker? And this is something that you really want to pay attention to for exams. So you want to make sure that you're paying attention to what's moving first. Is it the walker? Is it the weak side or the strong side? And how that order goes. So before a patient actually uses a walker for those first couple times, you want to make sure that you have applied a gait belt to their waist for safety. Also, you want to stand on the patient's weak side in case they start to stumble or fall. You want to be there. And you want to tell the patient before they start ambulating with their walker that they don't want to stare down at their feet while they're doing it, even though that just seems like something natural you want to do. That can actually mess them up and cause them to fall. They want to look straight ahead, just like if they were walking normally. And the starting position. How do they start out walking with their walker? Well, they want to make sure that the back tips of the walker match up with the middle of their foot. Now let's talk about how you actually ambulate with a walker. To ambulate with the walker, first the patient's going to get in position and hold on to the hand grips of the walker. First, they will lift and move the walker forward and then make sure all 4 points of the walker are touching the ground. Then they will move the weak side, put weight on the hands via the hand grips, and then move the strong side. Again, they will lift the walker, move it forward, make sure all 4 points are on the ground. Then they will move the weak side, put weight on the hand grips, and then move the strong side. To sit down in a chair, a patient is going to take their walker, hold onto the hand grips, and slowly back up to the chair until they fill the chair with the back of their legs. Then they're going to slightly extend that weak leg out and take their hands and position them behind them and bend their strong leg and feel for the chair's armrest and then set down. To get up from the chair, what the patient's going to do is, of course, make sure the walker is out in front of them. They're going to lean forward out of the chair, make sure their hands are on the handrest, and slightly extend that weak leg out. Then they are going to put weight on their hands by pushing up on the armrest of the chair and with their strong leg and putting their hands on the hand grip of the walker. Then they are ready to ambulate. And again, to do that, they will lift the walker, make sure all points are on the floor, move that weak leg, put weight on the hand grips, and then move the strong side. Thank you so much for watching. Don't forget to take the free quiz and to subscribe to our channel for more videos.